Most people believe that if something is seriously wrong with their liver, they will feel it immediately. They expect pain. They expect obvious symptoms. They expect their body to sound an alarm loud enough that it cannot be ignored. But after more than 25 years of caring for patients, I can tell you that the liver often works very differently. Here's what nobody tells you. One of the most important organs in your body can be struggling for months, sometimes even years, before it sends a clear warning. No dramatic pain, no emergency, no obvious symptoms. Just small changes, quiet signals, tiny clues that are easy to dismiss as normal aging. And that is exactly why today's conversation could be one of the most important health discussions you have this year. Because understanding these silent liver signs may help you protect your health, your independence, and your quality of life as you age. My name is Dr. Michael Anderson, and I have spent more than 25 years working with adults and seniors, helping them understand and manage chronic health conditions. Over the years, I have noticed something remarkable. Many patients who developed significant liver problems did not ignore severe symptoms. They ignored subtle ones. Symptoms they blamed on stress, poor sleep, getting older, or simply having a busy life. Time after time, I have seen how recognizing these quiet warning signs early can make an enormous difference. That's why I wanted to talk with you today about 7 silent liver signs that every adult over 60 should know. Before we discuss the signs themselves, let's talk about why the liver matters so much. Think of your liver as your body's chemical processing plant. Every day, it filters your blood, removes waste, processes medications, stores energy, helps digest food, and performs hundreds of other tasks behind the scenes. Most people never think about their liver because it works quietly and efficiently. But imagine if the filtration system in your home slowly started failing. At first, you might not notice anything. Then small problems would begin to appear. Over time, those small problems could become much larger ones. The liver works in a very similar way. When it becomes stressed or damaged, the signs are often subtle at first. That's why paying attention matters. The first silent liver sign is persistent fatigue. Many older adults assume feeling tired is simply part of getting older. And to be fair, fatigue can have many causes. Poor sleep, medications, stress, and other health conditions can all contribute. There is nothing unusual about feeling tired occasionally, but here's where things become interesting. The liver plays a major role in managing energy and processing nutrients. When it is not functioning efficiently, your body may struggle to use energy properly. I remember a patient in his late 60s who came to my office because he felt exhausted every afternoon. He wasn't in pain, he wasn't sick. He simply couldn't understand why his energy had disappeared. Further testing revealed significant fatty liver disease. The fatigue had been one of the earliest clues. Research has shown that ongoing unexplained fatigue is frequently reported among individuals with chronic liver conditions. If you find yourself constantly tired despite adequate rest, it may be worth discussing with your doctor. Have you noticed your energy changing in recent years without a clear explanation? The second sign is unexplained itching. This surprises many people because itching doesn't seem related to the liver at all. Most people assume dry skin is the cause, and often they are correct. Dry skin becomes more common as we age. However, persistent itching that doesn't improve with moisturizers can sometimes be linked to liver problems. When the liver struggles to process certain substances, they may build up in the bloodstream and irritate nerve endings in the skin. One patient described it as feeling like tiny, invisible insects were crawling across her arms at night. She spent months changing soaps, lotions, and detergents before finally seeking medical advice. The underlying issue turned out to involve her liver. Fortunately, once the problem was identified, treatment helped significantly. Were you aware that persistent itching can sometimes have causes that go far beyond the skin itself? The third sign is easy bruising. As people age, their skin naturally becomes thinner and more fragile. Many seniors notice bruises appearing more easily than they once did. In many cases, this is completely normal. But the liver plays an important role in producing proteins that help blood clot properly. When liver function declines, bruising may become more frequent or more noticeable. I remember a gentleman who thought he was simply becoming clumsy because bruises seemed to appear constantly on his arms. During his evaluation, we discovered early liver dysfunction. The bruises were not random. They were clues, small clues, but important ones. Have you ever noticed bruises appearing more often than they used to? The fourth sign is swelling in the legs or abdomen. This symptom often develops gradually, making it easy to overlook. People may blame weight gain, inactivity, or circulation problems. Those explanations are certainly possible, but when the liver becomes damaged, fluid regulation can be affected. Fluid may begin accumulating in the lower body or even around the abdomen. I once cared for a patient who thought she had simply gained a few pounds around her waist. What she was actually experiencing was fluid retention related to liver disease. The change happened so slowly that she barely noticed it until her clothing stopped fitting comfortably. Has this ever happened to you or someone you know? The fifth sign may be one of the most overlooked of all: changes in appetite. Many people lose interest in food occasionally. Stress, illness, medications, and emotional factors can all affect appetite. But a persistent loss of appetite deserves attention. The liver plays a major role in digestion and metabolism. When liver function becomes impaired, eating may feel less appealing, and some individuals notice they become full much more quickly than before. I recall one patient who told me she simply wasn't interested in meals anymore. She assumed it was part of aging. It wasn't. Her liver condition was affecting her body's normal digestive processes. Have you experienced changes in appetite that seemed unusual for you? The sixth sign is dark urine or pale-colored stools. This symptom often catches patients by surprise. Most people never think about the color of their urine or stool unless something dramatic changes. Yet these changes can sometimes provide valuable information about liver health. Certain substances processed by the liver help create the normal color we expect. When the liver isn't functioning properly, those colors can change. This doesn't always indicate a serious problem, but it should never be ignored. One patient mentioned the change almost as an afterthought during a routine appointment. That small observation led to further testing and an important diagnosis. Have you ever paid attention to these subtle changes in your body? Now we come to the seventh sign, and in many ways, it may be the most important of all. Mild yellowing of the eyes. Most people associate jaundice with severe illness. They imagine bright yellow skin that is impossible to miss. But early jaundice can be extremely subtle. Sometimes it appears first in the whites of the eyes. A family member notices it before the patient does. The liver normally processes a substance called bilirubin. When that process becomes impaired, bilirubin can build up in the body and create a yellow tint. I've seen patients dismiss this change for weeks because they assumed it was simply fatigue or poor lighting. What happened next surprised even them. Further testing revealed significant liver disease that required immediate attention. Have you ever looked closely at the whites of your eyes? But that's only part of the story. Knowing the signs is important, but understanding what to do next matters even more. If you notice any of these symptoms, don't panic. Most of these signs can be caused by many different conditions, and having one symptom does not mean you have liver disease. What matters is the pattern: symptoms that persist, symptoms that gradually worsen, symptoms that don't have an obvious explanation. One of the most important things you can do is schedule regular checkups. Ask your doctor about routine blood work. Discuss any changes you've noticed, even if they seem small. Pay attention to your energy levels, appetite, skin changes, and overall well-being. Small observations can provide valuable information. Avoid excessive alcohol consumption. Maintain a healthy weight. Stay physically active, and review your medications regularly with your healthcare provider. These simple habits can help support liver health over time. I want to share one final story because I believe it captures the message of today's video perfectly. Several years ago, a 72-year-old woman came to see me because she felt slightly more tired than usual. Nothing dramatic, no pain, no emergency. She simply felt different. During our conversation, she also mentioned occasional itching and a reduced appetite. Individually, none of these symptoms seemed alarming. Together, they told a story. Further testing revealed early-stage liver disease. Because we identified it early, we were able to make meaningful changes. She improved her nutrition, increased her physical activity, managed her weight, and worked closely with her healthcare team. A year later, many of her symptoms had improved significantly, and her liver health had stabilized. The lesson wasn't that she was lucky. The lesson was that she paid attention. If there is one message I hope you remember today, it is this. The liver rarely asks for attention loudly. It usually asks quietly. The small symptoms we dismiss today may become the important clues that protect our health tomorrow. Awareness is not about fear. Awareness is about giving yourself the opportunity to act early, ask questions, and make informed decisions. As we conclude, remember the 7 silent liver signs we discussed today. Persistent fatigue, unexplained itching, easy bruising, swelling, appetite changes, changes in urine or stool color, and yellowing of the eyes. None of these symptoms should automatically cause alarm, but each deserves attention if it persists or worsens. Stay informed, stay curious, take charge of your health, and never assume that every change is simply part of aging. I'd love to hear from you. Which of these liver signs surprised you the most? Have you ever experienced a symptom that seemed minor but turned out to be important? Share your thoughts in the comments below. Your experience may help someone else recognize a warning sign they might otherwise ignore. And if you found this information helpful, please consider sharing this video with a friend or loved one who could benefit from it. Thank you for spending this time with me. Take care of yourself, take care of your liver, and remember, small actions today can make a remarkable difference in your health tomorrow.